So I know that I kind of made a video after 6 weeks and disappeared. Um, but I'm now at about 9 months post-surgery from my shoulder. If you don't remember from the first one, it was rotator cuff, infraspinatus, bone spur, some nerve stuff, a lot of different things going on in there. Since then, when I made the last video, I was still in my sling. I did not get out of my sling from the time of surgery, which was 13 February, until July, which apparently is very uncommon, but it was pretty severe. So I didn't get medically released until July, about beginning close to middle of July from my sling. Since then, I've slowly been getting back into the routine of things. I definitely, not necessarily baby it, but I'm much more aware than what I was before. Before, I just kind of went into anything sports-wise or anything like that and just had fun with it. Now I'm definitely a lot more careful. Just had a birthday a week ago, so I'm definitely getting older, not younger. So my body's not healing as fast as what it was before. But it's been good. It's been rewarding, but it's also been very challenging. I still go to physical therapy twice a week because I still have a lot of pain that they're unsure why. So between the surgeon and my physical therapist, they're both really, really good as far as knowing what they're doing and what they're talking about. But the pain that I'm still experiencing is it's baffling them. Again, being so young and having this issue, and then being as athletic as I am, not understanding. Some say, and it could be there's a huge, theory behind it, and it makes sense to a certain degree that, I'm not giving it enough rest, which I've moved from 3 workouts a day, 5 days a week, to 2 workouts a day, 6 days a week. But even when I was doing a 3-a-days, I still worked out on Saturdays. It was just one longer workout. So, and now I'm much more open to a better work rest cycle for my body, paying attention to it, not overdoing it. I feel like I've become a lot smarter with it, and try not to irritate it at all. Oddly enough, where I'm having the pain is not where I had the surgery done. So that's the biggest concern or confusion behind it, because that wasn't the cause of my issues in the first place. So we really don't know why I'm experiencing the pain that I'm experiencing now. But it's not like debilitating or anything. I still, like I said, I'm still in the gym, still doing my sports. I just started back swimming, which is my regular sport, and just was able to do the butterfly stroke for the first time last week, so that was a huge accomplishment for me. But outside of that, it's really just trial and error stuff. For a while there, I got pretty discouraged. I didn't think I was ever going to come back. It was definitely a period of not necessarily depression, but going from being able to do all that I was doing before to not being able to do anything. And then once I got back into it, not being able to perform at the level that I performed at before. Now I really have no desire to perform at that level because it's not worth it. I mean, you only get one body, so I'm trying to take care of it better. I guess the really only advice I have is you have to be patient with it. That's been my biggest thing, is being patient. And now here I am 9 months later. It's rewarding. It has definitely paid off because, again, I'm back to doing majority of the things that I was doing before. The incision sites were pretty problematic. I have 4. Most people that I've spoken with that have had the surgery have only had like 2 or 3. The top one here gave me the most problems. My skin gets keloids pretty easily, and doing things like front squats or even putting on a bra or anything that rubbed over this one was pretty problematic. It was very sensitive. So I ended up having to go back to my surgeon and getting steroid shots injected in the actual incision sites to get them to go down. So the top one here and the one located on my rear delt, it was not fun at all to get that done. But it helped them go down, and they're not sensitive at all anymore. You can still see the scars, but they don't hurt, and I'm able to fully functional the way that I want to without experiencing any pain with that. Outside of that, I don't have full mobility yet. I still experience pain. So my left can get, kind of far back there, but this one is about right there until I start feeling pain. So I've been doing a lot of stretching. Thankfully, I am married to a massage therapist, so he always makes sure that I get pretty good massages here and there. And just using a lot of stability bands and stuff like that helps out a lot, or has been helping me out a lot. So hopefully this gives, if anyone is out there that is either about to go through this procedure or is still in the middle of recovering from it, hopefully this will give you a little bit of inspiration that A, age doesn't matter, B, being athletic doesn't matter either. The body has its own clock that it runs off of, and you want to abide by it if you want to heal from this in the best possible way. I will hit a year, obviously, in February, so maybe by then I can post another video, and hopefully I'll be able to get this arm all the way back there and not having this pain anymore. We'll see. Thank you for your time.